Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the heart. The heart is a hollow muscular organ. It is located in the middle mediastinum of the thorax. The heart has 4 chambers, 2 atria and 2 ventricles. The right ventricle, left ventricle, left atrium and right atrium. So, heart is a hollow muscular organ present in the middle mediastinum, and this has apex, base, and it has surfaces, borders. Okay, the apex is formed by the left ventricle. So this is the apex is formed by the left ventricle. This is the apex of the heart. This is the part of the left ventricle. So the apex is directed downwards, forwards and to the left. This is the apex. The base is just located on the opposite side in the posterior aspect of the heart. If we remove the arch of the aorta and the pulmonary trunk, we'll get this is the base of the heart. Base is directed backward and upward. Okay, this is the base. Base is formed by the left atrium and part of the right atrium. We got the apex. This is the apex and this is the base of the heart. Then we'll go to the margins and surfaces. Surfaces. Heart has surfaces. This is the sternocostal surface or anterior surface, and this is the diaphragmatic surface. This is the left pulmonary surface, right pulmonary surface. The base is on the posterior surface. Okay, so we have the left ventricle here. This is the left ventricle. This is the right ventricle. This is right atrium, and here is the left atrium. This is left atrium. So we got 4 chambers of the heart. Auricles are extensions of the atrium. This is the right auricle and this is the left auricle. Left auricle. Auricles are above the ventricles and they are anteriorly mostly. So this is the left auricle. This is an ear-like extension of the atrium. They are derived from the primitive atrium. So this is the left auricle. This is the right auricle. Okay, we got the auricles. We go to the margins. This is the inferior margin of the heart. Inferior margin. It is formed mostly by the right ventricle, partly by the left ventricle near the apex. So this is the inferior border of the heart. Inferior border of the heart. This is the left border of the heart. It is formed by the left ventricle, partly by the left auricle. Okay, so left ventricle, left auricle. Here the right margin of the heart is formed by the right atrium. Right ventricle does not make the right margin. Right margin is formed by the right atrium. Okay. On the sternocostal surface, 2/3 area is covered by the right ventricle, 1/3 area is covered by the left ventricle. On the diaphragmatic surface, left ventricle has maximum contribution. Okay, we got the apex, base, margins, and surfaces and borders of the heart. Superior border is ill-defined. We have the auricles, the left auricle, the right auricle. We have the pulmonary trunk, ascending aorta, and here is the superior vena cava. So the left auricle, pulmonary trunk, ascending aorta, the right auricle, and the superior vena cava. Okay, to identify the superior vena cava and inferior vena cava. This is superior vena cava. Superior vena cava is formed by the union of the left and right brachiocephalic veins. If you compare this heart, this small heart, this is the left brachiocephalic vein, this is the right brachiocephalic vein. They unite to form the superior vena cava. Superior vena cava opens into the right atrium. Superior vena cava also receives the azygous vein. This is azygous vein. So we'll compare here with the big model. This is the right brachiocephalic vein, left brachiocephalic vein. This is the superior vena cava opening into the right atrium. And here on the posterior part of the superior vena cava, we have the opening for the azygous vein. Okay, we got the superior vena cava. Superior vena cava is formed at the level of the right first costal cartilage. Superior vena cava penetrates the pericardium at the right second costal cartilage. Superior vena cava opens into the right atrium at the level of the third right costal cartilage. Okay, we got the superior vena cava. Then we'll go to the inferior vena cava. This is the inferior vena cava. Inferior vena cava is formed in the abdomen, the level of the lumbar vertebra 5. It is the content of the posterior abdominal wall in front of the lumbar vertebra. It penetrates the vena cava opening of the diaphragm at the level of T8. Then in the thorax, it has only a short course, only a few centimeters. Then it continued as the right atrium. So this is inferior vena cava. This is superior vena cava. Okay, we got that. Now we'll find out here in the big model. This is the superior vena cava. Okay, so I'm putting it here. Okay, this is the superior vena cava, and that is the inferior vena cava. Look at that, they are almost in the same line. Okay, the same line. Superior vena cava at the top, inferior vena cava at the lower part of the right atrium. So we got superior vena cava, inferior vena cava. Now we go inside the chambers of the heart. Okay, so we have 4 chambers. Here we have the left atrium, left ventricle, right atrium, right ventricle. Just compare that. This is the left ventricle, this is the right ventricle, this is the left atrium, this is the right atrium. Okay, we got the chambers of the heart. So we are now inside the heart here, and we'll find out some structures here. In the atrium, we have some part is smooth, posterior part is smooth, and anterior part is rough due to the presence of pectinate muscles. So pectinate muscles are present in the atrium. Pectinate muscle also extend. It is also found on the auricle wall is also containing the pectinate muscles. So this is the right atrium, right auricle. So on the anterior aspect of the right atrium and extending to the auricle, we have the pectinate muscles. Okay, so we got the pectinate muscles. It is also present in the left atrium. Okay, so if you go there, this is a part of the left atrium, the interior part of the left atrium plus the left auricle inside will get the pectinate muscles. So we have to find out that the pectinate muscles, where I will get pectinate muscle. Pectinate muscles are present in the anterior aspect of the left and right atria, left and right atria. Okay, and inside the auricles. Okay, we got the pectinate muscles. Okay, so if you go to the right atrium, then we'll also find out the right atrium. Here is the fossa ovalis. Here is the fossa ovalis. Here, this is the interatrial septum. The interatrial septum is the septum between the right atrium, left atrium, and this is the interatrial septum. And on the interatrial septum, we'll get a thumbprint like impression here. We call it fossa ovalis. So if I just compare that with that of my small model, okay, we'll get the fossa ovalis. Here is the fossa ovalis on the interatrial septum. Okay, so we got fossa ovalis. Fossa ovalis is here on the interatrial septum inside the right atrium. This is the fossa ovalis. This is a thumbprint like impression here on the interatrial septum. So we must know what is fossa ovalis. So fossa ovalis, it represents the valve of the foramen ovale. Okay, so fossa ovalis. Okay, represents the valve of the fetal foramen ovale. Okay, so it represents the valve of the foramen ovale, and it has a margin. This is called limbus of fossa ovalis. So limbus of fossa ovalis. This is the margin of the fossa ovalis. Fossa ovalis. Okay, so this is the fossa ovalis, the depressed part on the interatrial septum. Then the margin is called limbus of fossa ovalis. This is the fossa ovalis. Fossa ovalis, and this is called limbus of fossa ovalis. Okay, we got the fossa ovalis, limbus of fossa ovalis. In the right atrium, we have also an opening for the coronary sinus. So what structures opens into the right atrium? Okay, what structures opens into the right atrium? Okay. Structures opening into the right atrium. Okay, we have the opening for the superior vena cava. Superior vena cava opens into the right atrium. Inferior vena cava opens into the right atrium, and the coronary sinus opens into the right atrium. So, superior vena cava, inferior vena cava, and the coronary sinus. Coronary sinus is the major vein in the wall of the heart. Okay. So, there is the opening for coronary sinus. This is the opening for the coronary sinus is here. Opening for coronary sinus. This is the superior vena cava. This is the inferior vena cava. And this is the opening for coronary sinus. And this is the coronary sinus. It opens into the right atrium. Okay. We got the opening for the coronary sinus. Now, what are the tributaries of coronary sinus? Coronary sinus is a vein. So, we must know the tributaries of the coronary sinus. Tributaries. Tributaries of the coronary sinus. We have the great cardiac vein. We have the middle cardiac vein. Okay. Small cardiac vein. We have left ventricular vein. And also we have the left marginal vein. Okay, we'll identify them, those all here in our model. Okay, so if we just follow that, okay, this is the coronary sinus here. This is the coronary sinus here. This is the small cardiac vein here. Small cardiac vein. We have some left ventricular vein. This is the left marginal vein. Okay, and this is the great cardiac vein. Great cardiac vein may be splitted too. Okay, that is present by the side of the anterior interventricular artery or LAD. So this is the great cardiac vein. This great cardiac vein. This is the left marginal vein. Okay, usually it is a tributary of the coronary sinus. Sometimes it may be a tributary of the great cardiac vein. It may be possible. Okay, so we got the coronary sinus and its tributaries. The heart also get very small veins that opens into all the chambers of the heart. We call it Vena cordis minimi. Okay, so we have Vena cordis minimi. These are small veins that may open into any chamber of the heart. Okay, we have another vein we need to mention, that is the marginal vein. We can call it right marginal vein. This is the right marginal vein that passes along the inferior border of the heart. Okay, right marginal vein may open into the into the right atrium directly, or right marginal vein may be a tributary or continuation of the small cardiac vein. Okay, so it has variable destination, it's variable formation and termination. Okay, we may have also some anterior cardiac vein that actually drain venous blood from the anterior part of the right ventricle. They open into the right atrium or right auricle independently, not going to the coronary sinus. Okay, we got that. Then we'll go inside the heart again. Okay, we'll go inside the heart, and we have the right atrium, right ventricle. This is a part of the right atrioventricular valve here. The right atrioventricular valve is here. Okay, so this is right atrioventricular valve. This is the right ventricle. This is right atrium. This is left atrium, left ventricle. This is a left atrioventricular valve. Okay, so we have the left and right atrioventricular valve. Left atrioventricular valve is also called bicuspid valve because it has two cusps, and it is also called mitral valve because when they come close together to cusp, they look like the mitre of a bishop, okay, in a church. So it is also called mitral valve. Okay, we got that. This is one of the cusp of the mitral valve. Another cusp is here. Here is another cusp. Another cusp is here. This is the another cusp of the mitral valve. Okay, so we got that. The mitral valve or left atrioventricular valve, right atrioventricular valve. Right atrioventricular valve will go there. Okay, so right atrioventricular valve. Right atrioventricular valve, also called tricuspid valve. Okay, is also called tricuspid valve. Okay, so right atrioventricular valve has three cusps. In our model, we're seeing only two. Actually, we should have three cusps like this. This is one. We should have another one from the septal region, another one from the anterior region. Okay, so like this, we have this one is the anterior, and we should have another one from the septal area. Okay, so we should have three cusps in the right atrioventricular opening, that is guarding blood from the right atrium to the right ventricle. Okay, we got that. Now if we go to the right ventricle, certainly we'll get some muscle. We call them the papillary muscles. These are the papillary muscles. Okay, so papillary muscles are present in the ventricle. If you remember that, papillary muscles are present inside the ventricles. Okay, but the pectinate muscles are present in the atria, left atria, right atria on the anterior aspect, also in the auricle. So papillary muscles are present in the ventricle. Right ventricle has three papillary muscles. Okay, left ventricle has two papillary muscles. Papillary muscles. We got the papillary muscles. Let's identify them. Okay, so these are the papillary muscle. This is papillary muscle. Papillary muscle is important. These contain cardiac muscle, and from the papillary muscle we get the chordae tendineae. So suppose this is a papillary muscle and this is the cusp of the valve, cusp of a valve of the heart. This is the papillary muscle. Okay, so we have some cord-like structure. These are cord, these are connective tissue. This is cardiac muscle. This is the cusp, mostly connective tissue with endothelial covering on both surfaces. These are the cord-like structure. This is called chordae tendineae. Chordae tendineae. Okay, they have some role. Role is to prevent excessive bulging of the valve inside the atrium during systole. So this chordae tendineae plus papillary muscle regulate the bulging of the atrioventricular valve to the atrium during ventricular systole. Okay, we got the papillary muscle in the left ventricle. This is papillary muscle. Right ventricle, these are papillary muscle. Usually the left ventricular papillary muscle is larger than that of the right ventricular papillary muscles. Okay, and also if you look at the wall, left ventricular wall is thicker than that of the right ventricle. It contains thick cardiac muscle. The cardiac muscle is also present here, but it is thinner than that of the left ventricle. Left ventricle is thicker because left ventricle pumps blood to the entire body. It works against too much peripheral resistance. Okay, and the right ventricle pumps blood towards the lung with less peripheral resistance. Okay, we got that. So these are cardiac muscle. It is present in the interatrial septum, interventricular septum, wall of the ventricle, and we have also modified cardiac muscle. Those forms the conducting system of the heart, SA node, AV node, bundle of His. So we should have SA node, junction between the superior vena cava and the right atrium, AV node in the triangle of Koch area here. Then we have bundle of His or AV bundle. Then we have the left branch, right branch. Then we have the Purkinje fiber in the wall of the ventricle, towards the myocardium and then towards the endocardium. Okay, so this is epicardium or visceral layer of serous pericardium. This is myocardium. This is endocardium. Okay, this is lined by simple squamous epithelium. This is cardiac muscle. We know the cardiac muscle with branching pattern, usually centrally located nucleus, intercalated disc. Okay, and this is cardiac muscle. Inside we have the endothelium. Okay, we call it endocardium. This is simple squamous epithelium. Okay, we got cardiac muscle. Now, if we go to the major blood vessels, that those are coming from the heart. Okay, let me try here. Put it here. Okay, here we have to find out that this is called pulmonary trunk. It is coming out of the right ventricle. Pulmonary trunk has two divisions: the left pulmonary artery, the right pulmonary artery. So left pulmonary artery going to the left lung, right pulmonary artery going to the right lung. Okay, we got the pulmonary artery. Okay, this is the ascending aorta. This is the arch of the aorta, and this is the descending thoracic aorta. So ascending aorta, arch of the aorta, and descending thoracic aorta. Okay, from the ascending aorta ascend from where? From the left ventricle. Okay, so ascending aorta ascends from left ventricle. Pulmonary trunk comes out of right ventricle. So if you go to the pulmonary trunk, it comes out of right ventricle. Okay, and pulmonary trunk comes out from the conus arteriosus of the right ventricle. Okay, what is conus arteriosus? Conus arteriosus is the conical upper part of the right ventricle, the outflow part of the right ventricle, from where the pulmonary trunk arises. Okay, then we'll go to find out the connection between the bifurcation of the pulmonary trunk to the arch of the aorta. We have a connection and we call it the ligamentum arteriosum. This is the white spot here. This is the ligamentum arteriosum. Okay, this is the ligamentum arteriosum connecting the bifurcation from the proximal part of the left pulmonary artery to the arch of the aorta. Okay, near the bifurcation of the pulmonary trunk. So we have to know what is the ligamentum arteriosum. Ligamentum arteriosum represents the embryonic ductus arteriosus. Represents the ductus arteriosus. Ductus arteriosus that is present during intrauterine life. Idea is that lungs don't need much blood, so most of the blood coming to the right ventricle bypasses the lung and go to the systemic circulation through the connection between the bifurcation of pulmonary trunk to the arch of the aorta. Actually, from the left pulmonary artery near the bifurcation to the arch of the aorta, okay, blood is bypassed. Lung don't need too much blood, so blood is going to the systemic circulation through the ductus arteriosus. This was active during intrauterine life. So this is present in the intrauterine life. Okay. So once baby is born, ductus arteriosus closes and we get ligamentum arteriosum. Okay. Sometimes it may not close. We call it patent ductus arteriosus. Patent ductus arteriosus. Okay. So we may get a congenital birth defect, the patent ductus arteriosus, maybe due to prematurity, maybe due to maternal diabetes mellitus, maybe due to high mountain living. That is possible. Okay. So we got the left ventricle, right ventricle inside. Then we will find out the arch of the aorta. Arch of the aorta has three major branches, and we must identify the branches. Okay. So what are the branches of the arch of the aorta? First branch is the brachiocephalic trunk. Then left common carotid artery, left subclavian artery. So these are the branches. The brachiocephalic trunk, left common carotid artery, left subclavian artery. So what are the branches of the arch of the aorta? Okay. Branches of the arch of the aorta, these are the brachiocephalic trunk, brachiocephalic trunk, also called brachiocephalic artery. Okay. Then left common carotid artery, common carotid artery. We have the left subclavian artery, left subclavian artery. Okay, we got that. Then we get the descending thoracic aorta. Okay, so this is the descending thoracic aorta. We are seeing some branching. These are mostly the posterior intercostal arteries. We have from 3rd, 4th, 5th, 6th, 7th, 8th, 9th, 10th, 11th, 12th intercostal spaces. We have posterior intercostal arteries. These are branches of the arch. These are branches of the descending thoracic aorta. Arch of the aorta has only 3 branches. So we'll summarize again. What are the branches of ascending aorta? So these are the branches of arch of the aorta: brachiocephalic trunk, left common carotid artery, left subclavian artery. So what are the branches of the ascending aorta? Ascending aorta has 2 branches. One is the left coronary artery. Another one is the right coronary artery. So left and right coronary artery, we have to identify them. Okay. So if I take out that, we'll find out the this is the part of the ascending aorta. This is the left coronary artery, right coronary artery. This is the aortic semilunar valve. This is the pulmonary semilunar valve. So pulmonary semilunar valve, aortic semilunar valve. They have also 3 cusps, but we call them semilunar valve because the valve looks like semi-lune or part moon shape. So we got that. This is the left coronary artery coming out of the left aortic sinus, right coronary artery coming out of the right aortic sinus. Okay, so we got left and right coronary arteries. Now we'll find out the branches of the left coronary artery. Okay, what are the branches of left coronary artery? We have the anterior interventricular artery, anterior interventricular artery, also called left anterior descending artery, left anterior descending artery, or simply called LAD, is one branch. What are other branches of left coronary artery? We have the circumflex artery, circumflex artery. Okay, so to identify them. So this is the LAD or anterior interventricular artery. This artery is present in the anterior interventricular groove, and this artery is accompanied by the great cardiac vein. So what are the contents of the anterior interventricular groove? the LAD or anterior interventricular artery or left anterior descending branch of the left coronary artery, and the great cardiac vein. Great cardiac vein is a tributary of what? It is a tributary of the coronary sinus. Okay, so we got the anterior interventricular artery. This is the circumflex artery. That is the circumflex artery here. Okay, this is the circumflex artery. It encircles the left margin of the heart or the upper part of the left ventricle. That is called the circumflex artery. From circumflex artery, we may get the left marginal artery. This is the left marginal artery. Okay, so we got two major branches of the left coronary artery. One is the anterior interventricular artery or LAD or left anterior descending artery. Another one is the circumflex artery. Okay, so circumflex artery has what branch? It is the left marginal artery. So circumflex artery has the branch called left marginal artery. Any branch from left interventricular artery? Yes, we may get lateral diagonal branch. Lateral diagonal branch of LAD. Okay, so if we go here, branches of left coronary artery, the LAD or anterior interventricular artery, it has a branch called lateral diagonal branch of LAD. Usually go laterally, diagonally. It goes diagonally. It is not very much good in this model. Okay. Second branch is circumflex artery that encircle the left margin of the heart, the upper part of the left ventricle, and it has a branch, we call it left marginal artery. Okay, we got the branches of the left coronary artery. Now, what are the branches of the right coronary artery? Okay, right coronary artery. Right coronary artery has branches like if we go there, we have the right marginal artery, and the posterior interventricular artery, also called posterior descending artery, posterior interventricular artery. Okay. Right marginal artery is accompanied by right marginal vein. Right marginal vein may be a continuation of the small cardiac vein, or it may be independent vein that opens into the right atrium directly. Right marginal artery is always a branch of right coronary artery. It passes along the inferior border of the heart. Okay, so posterior interventricular artery is present in the posterior interventricular groove, and this is accompanied by middle cardiac vein. So accompanied by middle cardiac vein. Okay, we'll find out that in our model. Okay, so here we are now. This is the right coronary artery going down here, and this is the right marginal artery. Right marginal artery is giving it is providing blood supply along the right border of the heart, but right marginal artery going posteriorly, and it will give rise to the posterior interventricular artery, and posterior interventricular artery is accompanied by middle cardiac vein. Middle cardiac vein is a tributary of coronary sinus. This is coronary sinus. This is the middle cardiac vein. This is the posterior interventricular artery, also called posterior descending artery, and this may communicate with that of the LAD. Okay, we got that. If we just compare this model with my small model, okay, we'll find out that here we'll find out that this is the right coronary artery. This is right coronary artery. This is the posterior intraventricular artery, middle cardiac vein. Okay, so we may have a branch here. Yes, this should be a little bit down. Okay, this is the right marginal artery. This is the right coronary artery here. Okay, it goes down between the right auricle, right ventricle. Okay, this is the left coronary artery. This is the LAD or anterior interventricular artery. This is the circumflex branch of the left coronary artery. This is the left marginal artery. You have to remember that orientation of the branches of the coronary arteries may vary from person to person, even from model to model. Okay, we got that. So if we go to the smallest model, here this is what? This is the right coronary artery. This should be the right marginal artery. This is the posterior interventricular artery. This is middle cardiac vein. This is coronary sinus. Okay, and this is small cardiac vein. Here it continued as that of the right marginal vein. This is the LAD, and this is the circumflex artery, and the circumflex artery may communicate with that of the right coronary artery. This is the right marginal artery. Okay, we got that. Okay, if you go inside the right atrium, we got the fossa ovalis here. Okay, and we got the papillary muscle. This is the tricuspid valve or right atrioventricular valve. This is the opening of the right. This is the outflow tract of the right ventricle.